Welcome back. Now, in a moment, we have a guest coming up, Dr. Russell Blaylock. But first, we have continued controversy over the HPV vaccine comments that Michelle Bachmann made during last week's GOP debate. The American Academy of Pediatrics countered her claim that the vaccine causes retardation, saying the medical community issued swift criticism after Rep. Michelle Bachmann dragged the safety of the HPV vaccine into the political spotlight, saying since the vaccine has been introduced, more than 35 million doses have been administered and it has an excellent safety record. On the other hand, we have the CDC's own statistics, and we're about to get into this with Dr. Blaylock, of over 18,000 adverse reports and many deaths as well. For more on that vaccine controversy, we take you to Rob Dew's investigative piece right now.
Is he less conservative than meets the eye?
Gardasil has once again entered the presidential debate. First, it was Ron Paul attacking Rick Perry.
Forcing 12-year-old girls to take an inoculation to prevent this sexually transmitted disease. This is not good medicine, I do not believe.
And now it's Michelle Bachmann.
The governor's former chief of staff was the chief lobbyist for this drug company. The drug company gave thousands of dollars in political donations to the governor.
Well, I will tell you that I had a mother last night come up to me here in Tampa, Florida, after the debate. She told me that her little daughter took that vaccine, that injection, and she suffered from mental retardation thereafter.
Doctors around the country are offering rewards for proof of her claim that one of her friend's daughters is now mentally retarded after receiving the Gardasil vaccine. The former IRS attack dog is now on the defensive.
John, is there any science that suggests HPV vaccine can have that effect?
Scott, it's so important to separate the politics from the science. What the science says, this is a vaccine that can prevent the virus that causes cancer of the cervix. There are 35 million doses that have been given in the United States since 2006. According to the Centers for Disease Control, the Institute of Medicine, and the American Academy of Pediatrics, there's no link between this vaccine and any kind of mental impairment.
And the media has once again come to the defense of the vaccine industry.
We don't need to start a new sort of controversy. There are no data to indicate that HPV vaccine or any other vaccine has any association with mental retardation.
Of course, this has nothing to do with the amount of advertising Big Pharma buys each year.
I chose to get my daughter vaccinated.
I chose to get my daughter vaccinated when her doctor and I agreed that the right time to protect her is now, because it's about prevention.
Right.
Gardasil is the only cervical cancer vaccine that helps protect against 4 types of HPV.
HPV vaccine and other vaccines are wonderfully safe vaccines.
So who is Dr. William Schaffner? He is the president of the National Foundation for Infectious Diseases, an organization that has given awards to the Bill and Melinda Gates Foundation and Dr. Paul Offit, a vehement vaccine promoter who holds a $1.5 million research chair at a Merck-funded children's hospital and holds several patents on vaccines. He's also been quoted as saying a young baby could get up to 10,000 vaccines at once. These doctors should take this reward money and give it to the thousands of girls that you can find all over YouTube who have had adverse reactions after getting the Gardasil vaccination.
Gabby was diagnosed with inflammation of the central nervous system as a result of the Gardasil vaccine. She suffered from 2 TIAs, or mini strokes. She is now vomiting on a regular basis.
I had an adverse reaction. I lost the ability to walk. I started falling down. I needed help. I had head pressure. This is very hard to talk about.
If I had never gotten this shot, I would be a normal teenager, and I wish I could go back. I wish there was a way to cure this, and I hope that they can figure something out, a treatment plan. But I can't plan for that.
I got my second Gardasil shot in January of 2008. Now it's November of 2008. And I've had problems every day ever since.
Doctors like vaccines because they will cause large percentages of the population to become lifelong customers, whether it's allergies, autoimmune diseases, or any other types of inflammation. These people will need expensive treatments and prescription drugs. And that is why you now see vaccine companies setting their sights on every Mexican girl by the year 2012.
Ahora, con Gardasil, la única vacuna que protege contra los
This is Rob Dew reporting for InfoWars Nightly News.
40% del cáncer del cuello.
That's just devastating footage, and there's even more interviews from CBS and other major mainstream reporters on the true face of Gardasil, the victims it causes, the people it hurts. And they only claim there's, 4,000 deaths from cervical cancer each year, yet there's more than 18,000 adverse reactions, at least 30 deaths from the vaccine itself. It's really disgusting. For more on the debate over the safety of vaccines, we go now to expert Dr. Russell Blaylock. Doctor, we spoke a year ago in depth on some of these issues, but what can you tell us today about the dangers of the HPV, Gardasil, and Cervarix vaccines, and about the effects of vaccines in general?
Well, it's well known that there's a connection between vaccination, particularly multiple vaccinations, and brain inflammation and seizures. That's been well established. It's been recently admitted by the Institute of Medicine that these are two things that are seen. So the fact that Representative Bachmann was attacked for her statement is rather ludicrous on the part of these doctors and others that are attacking her, because it's backed up by the scientific studies. And we know there's a well-defined mechanism, which I've written several papers in peer-reviewed journals describing this mechanism in detail. Now, we look at the government reporting system, the VAERS system, which is voluntary. Only 2%, it's estimated, of actual reactions are reported. But they admit 18,700 adverse reactions with the Gardasil vaccine. And they admit that 8,000 are serious. That is 1,400 young girls, age 11 and above, have been seriously damaged by this vaccine. And that includes 68 young girls who died. Now, again, this is a reporting system that's voluntary by the physicians. So we find out that actually the numbers are much higher than that. It's been estimated there's 176,000 injuries due to this vaccine, of which there's over 13,000 that are serious, and there may be as many as 600 girls that have died following this vaccine. So if we look at the truth of this vaccine, we see it's a very dangerous vaccine. Now, one of the things about it is its adjuvant, that is the immune stimulating part of the vaccine. It contains twice as much brain damaging aluminum as other vaccines. And so that would explain why we're seeing so much problem with this particular vaccine. But the problem is the whole thing is predicated on an enormous deception. And that's the idea that, and they're telling these girls in the doctor's office that if your daughter gets an HPV infection, she's going to develop cervical cancer and probably die from it. Well, if you look at the scientific information, that's not true at all. What we actually see is that death from cervical cancer is extremely rare, and that the majority of women who are HPV infected are not going to develop cervical cancer. And those that do, this extremely small percent, about 1% of all women who develop cervical cancer, most of them are going to occur when they're age 50 and above. So this 11-year-old girl that they want to vaccinate, 20-year-old girl, is not in any real danger until she's in her 50s. If we look at the accepted statistics, 1% of women less than age 30 will develop cervical cancer. Now, that's 100 cases in the entire United States. Just 9% below age 40 will develop cervical cancer. 73% of cases occur in women that are above age 50. So we're talking about preventing a disorder that's extremely rare, that occurs mostly in women over age 50, and yet they want to vaccinate them when they're 11 years old. Well, they've even admitted the vaccine probably will not have any effectiveness at all after 5 years from the vaccine. So that means by the time the girl's 16 years old, the vaccine is useless. There's no evidence whatsoever that this vaccine prevents cervical cancer. There's little evidence that it even reduces HPV infection of the cervix, even though that's possible. We know that 90% of girls that get infected with HPV virus, it will clear by itself. In other words, they get the clearing and curing of the virus by itself, without any treatment. And that only 10% is the virus persistent, and only a small percentage of that 10% will ever develop cervical cancer. And again, it's after age 50 or around that age. So what's being told is an enormous lie that we're preventing death from cervical cancer by this vaccine, when none of those things seem to be true. It's not preventing the HPV that we've been led to believe. This vaccine was fast-tracked, went through approval within 6 months without adequate testing. It still has not been adequately tested. There's no evidence it prevents cervical cancer. And we know that there's a lot of other cofactors that HPV virus by itself, even HPV 16 type, by itself cannot produce cervical cancer. It has to have cofactors. These include smoking, exposure to long-term birth control pills, multiple sex partners, poor hygiene, poor diet. And we find, in fact, there's some excellent studies done that show if young women consume folate, folic acid, and vitamin B12, they reduce their incidence of HPV infection itself 74%, which far exceeds what we've seen with this vaccine, and it reduces the incidence of cervical cancer 70%. So here you have a simple way to prevent cervical cancer in these young girls without endangering them, because folic acid B12 certainly doesn't kill 68 young women, or that's the higher number that we discussed. Now, if you want to make something mandatory, why don't you make it mandatory that all young girls take folic acid B12 and stop smoking? Because those are the leading causes of cervical cancer. And that's been proven time and again by numerous laboratories and numerous studies. And we know that this HPV vaccine only produces cervical cancer in the presence of significant folic acid B12 deficiency, and that smoking produces vitamin B12 folic acid deficiency. So the whole thing is predicated on a lie. It's there for nothing but producing sales for the vaccine manufacturer, the Merck Pharmaceutical Company, to sell these vaccines. They're secretly going around to state legislatures trying to get mandatory laws passed, like Governor Perry did. He accepted $5,000 each from 3 different pharmaceutical vaccine manufacturers, over $377,000 that Merck Pharmaceutical put in the Governors Association of Texas for the good governor to mandate this vaccine. And there was no evidence that it needed to be mandated. So this whole thing is just a farce, but it's a dangerous farce because they're destroying the lives of these young girls. Many of these girls are having repeated seizures. They're crippled by arthritis. They're having cognitive problems, cannot remember, cannot learn. They're having to drop out of their sports events. They're having to have a lot of difficulty with their schooling. And this is all being covered up, not discussed by the media. And mothers need to know, start asking some serious questions. And what they'll find out is many of these physicians know absolutely nothing about HPV infection. They know nothing about cervical cancer and the relationship to HPV vaccinations.
The other question is, how much influence does the big pharma industry have over politics? Why are we seeing a wave of backlash against Michelle Bachmann, a political candidate's comments that HPV causes, quote, retardation, and saying there's no data when there's all the incidence reports we've just talked about? Are they playing semantical games with the definition of retardation, or are they simply denying that this is a dangerous vaccine that was allowed to be pushed on a political level?